calling the Berlin-Boylston Regional School Committee meeting on January 11th, 6:30 to order. Welcome everybody on a cold night. I want to make a note that we are meeting on Zoom tonight. Normally we'd be meeting at Tohoto, and we were expecting to meet at Tohoto. My concern in changing, and this is my decision as chair, so I just want to make note of this. I changed the meeting to Zoom because a couple of members of our group here are at home with COVID, asymptomatic and interested, wanting to be participating in tonight's meeting. And we don't have the technology in the district to allow us to have our conversations on site and for people to participate remotely. I know that that seems surprising, but it's the reality. And because we can't accommodate those people at home who are able to participate, and we want them to be participating tonight, I decided to shift to a Zoom night so that everybody could be at the table. So I also just want to make a comment that with the start of return from vacation, you can feel that everybody's temperatures are running high on multiple fronts, right? Both physically, if they have COVID, and emotionally, because people are very anxious about the high COVID numbers that are occurring right now. And you can feel the return to a lot of tension and stress that we felt earlier in the year. So I just want to remind everybody, including any public who may be watching or may view this later, that we need to continue to work to try to presume positive intentions. We're all on the same team. We all have the same interests of students at heart, and we may have different views or experiences that inform our positions, but we need to remember that we're all on the same team, and we need to work to listen to each other and to work productively to solve problems together, which they will continue to arise as COVID keeps changing the landscape. So I just want to remind people that we'll take a breath and let's see what we can accomplish together. So we have a couple of people who have indicated they'd like to make public comments tonight. And Christy, let you announce who is making comments first and to give them permissions to speak to the committee.
Okay, first up we have Katrina Lawson from Boylston. I don't see her name on our participants list.
Maybe not here yet.
Yeah, there's someone named iPad 12 that could possibly be her, but I'm not sure.
So Katrina, if you would identify yourself somehow, if you're here. Okay, so I'm going to suggest that we move on to the second person and return to see if Katrina's in attendance after this next person.
Okay, next we have Jessica Degley-Alberti from Boylston, and I'm going to promote her to panelist.
Hi, Jessica. Can't hear you yet.
Sorry.
Okay.
I apologize. I'm in clinic, so that's why I'm masked.
Okay. Welcome.
And I'm texting Katrina Lawson and see where she's at. Dear Boylston Berlin's school district, school committee members, and members of the administration, many members know me. But for the new members, I'm Jessica Moore Degley-Alberti. I'm a family nurse practitioner at the Edward M. Kennedy Community Health Center down in Great Brook Valley in Worcester. I'm a primary care provider, and as you are, also in the thick of this pandemic. I also have a third grader at Boylston Elementary School. So just like this meeting is now Zoom, because members are positive. We also are reducing our in-office visits by 40% and switching them to tele because of the surge, just to recognize that there is a surge right now. So right now, we need to use common sense when our leaders, the CDC and the DESE, has failed us. The principals and the school nurses are doing their best, and I appreciate their efforts wholeheartedly. So the 6-foot rule should be null and void. Omicron is airborne and it's not droplet. It cares not where you are in the room. If you remember back from when Mr. Zangi showed us the New York Times augmented reality article, all those kids were masked, and by the end of the augmented reality, the COVID was throughout the room, and that's why open windows and purifiers were entered into the equation. Our students are in the class together for 6 hours, even with masks of virus all over the room, and it's suspended in the air for up to 16 hours because it is airborne, not droplet like the flu. All students should be part of the test and stay quarantine if they're in the same room with a positive staff or student. Vaccinated are not quarantining or participating in test and stay per the CDC and the DESE. So the July 4th outbreak in Provincetown taught us that Delta didn't care about vaccines. There were breakout cases and all needed to wear masks following that. The holidays again have shown us that vaccinated people, and as of this afternoon, Massachusetts has a total of 82,466 breakthrough cases from Omicron and Delta. What do we learn from this? The test and stay should be for all students and staff, regardless of vaccination status. That also brings me to the question of why does Boylston Berlin not participate in pool testing? This would be able to find and capture a lot of the asymptomatic cases and stop spread. I don't remember why we didn't participate, so I apologize. Lunch. CDC was short-sighted when they released the new quarantine guidelines. You're having students on days 6 through 10 eating in the same cafeteria as 2 whole grades, that's 40 kids. Then there's more lunches that follow those. Omicron and Delta are airborne, hang in the air, like I said, for up to 16 hours. Honestly, if there's someone positive in the first lunch, that could infect the whole student body by the end of the day. We need to consider to break up lunches once again and increase the ventilation measures in the cafeteria. I have again pulled my daughter for lunch because it's not safe for her to eat indoors with others. So a small case study from BES. Last week, there was an exposure in my daughter's class on Tuesday. I didn't find out until Thursday night when my daughter mentioned that some students went down to the school nurse and did not return. My daughter was not within 6 feet of the seating on the seating chart, and so was not considered a close contact. Again, they're limited by the CDC and the DESE's recommendations. I later confirmed this exposure that was on Tuesday with staff. At the very least, the entire class needs to be notified of the exposure, and I do thank Mr. Thompson for starting to do that this week. Kids also do indoor extracurricular activities like basketball, and they also see high-risk family members. Knowing that they had an active exposure will make them test themselves if they desire, but maybe also avoid these indoor activities and not see high-risk members. I tested my daughter Friday at the fire station when they still had tests. They no longer do. And again on Monday morning because a kind friend lent me one of her tests. Both thankfully negative, so she wouldn't be spreading to her classmates despite being vaccinated when she went to school on Monday. Yesterday, Monday, I received a text message from another mom in her class about an exposure, and then thankfully received an email, like I said, from Mr. Thompson regarding exposure in the class. But no phone call because again, not within 6 feet. I did not send my 3rd grader to school today. We are not testing or quarantining who we need to, and I'm not knowingly sending her to a whirlwind of COVID as it washes over the entire class. Perhaps a bit poetic and dramatic, but true nonetheless. And honestly, I hate to be correct in this instance, but another classmate's mother tested me today that she was contacted to have her daughter do test and stay from exposure again today in their class. Staying in class is so very important for children's education and mental health. Remote learning was a series of meltdowns from my daughter over work that she would have no issue doing within the classroom. However, DESE's policy of no remote learning is so incredibly short-sighted. Some years, some classes or schools have been shut down to flu outbreaks, but we're dealing with Omicron, COVID-19 variant. It's airborne, super contagious, yet we cannot go remote or cancel school to stop the spread. What percentage of the school has to be out before we go remote or close the school for a few days to break the cycle of transmission? Please ask each of the principals what percentage of students and staff are currently, how many cases occurred Monday and Tuesday this week alone, ignoring 71 cases of Tohoto, 15 at BES, and 2 at BMS last week. If you need a case study on the current policies, ask Mr. Thompson for more specific numbers of my daughter's class outbreak. It could have been prevented if the whole class was quarantined last Tuesday, or whole class participated in test and stay, and the outdated 6-foot rule was thrown out the window. Again, they're limited by these policies that are outdated. Please consider going remote or call a cold day or snow day or whatever you'd like to call it and make it up in June. In June, at least rates should be lower and classes can be outside for lunch and staff. Consult with the boards of health from each town if you must, but common sense sees the tides of what's coming if current policies are followed. The principals and school nurses' hands are tied if the school committee doesn't take action to protect the students. Again, consider why this meeting is over Zoom and expand that to unmasked school lunches and outbreaks within the classrooms. Signed, a tired mother of a 3rd grader at BES and a family nurse practitioner. Jessica Moore, Dudley, Alberti.
Thank you very much, Jessica. Appreciate that. And your letter has been shared with the whole school committee.
Thank you.
I think Katrina Lawton is in the room. So Christy, if you could bring her up.
Can you hear me?
There we go. Good. Welcome. Thanks.
Hi. So I don't have a as formal a letter as Jess does.
Okay.
But I was kind of made aware last minute. Well, I knew about the committee meeting. I just didn't know if I was going to join or not. But I will say a few things that are concerning me right now. So my biggest issue is with the guidelines regarding the test and stay. It seems to me that the vaccinated children do not have to participate in the test and stay if they don't want to. They can still stay in school and attend while possibly remaining positive, while unvaccinated children have to participate or they can't attend school. And this is for school close contacts. And then even at home close contacts, vaccinated children are still allowed to attend school regardless if they're positive or not. And I say that because we don't know if they're walking around positive. And up until recent CDC guidelines, my child, who I will say is unvaccinated, was almost going to have to miss 18 days of school, while a friend who is vaccinated in the same circumstance would be able to attend school. Now, my biggest problem with this is there's no medical data right now, and we all know this, that is regarding vaccination and spread. If the vaccinated children did not spread this, then that would make sense to me. But these rules that, are for some and not for others, they need to medically make sense. I will follow these rules for my child if she's the unvaccinated child, if the other children didn't spread this. So why are they being treated differently? The virus is non-discriminatory. So why are we placing discriminatory guidelines on certain groups of children? And what concerns me is I don't want this to be a preview of the future where we have new rules in place regarding masks. So we're going to lift the mask mandates, but are they going to be only for vaccinated children? These things are a problem to me. And, I don't want this. We all have our own views about the virus. The virus has shut everybody up, I think, at this point, and has done its own thing. And I think if we are treating the kids equally, we have their best interests at heart. If all these rules are in place to stop the spread, then they need to be universal, regardless of everybody's opinion on it. That's really, I just want it to stop not making sense for the sake of following the rules, because the rules don't make sense right now and they're affecting our children. I don't want it to get to a point where because at some point kids are going to find out who's vaccinated and not, and then wondering why so-and-so keeps going to the office to get tested and so-and-so's not. And then are we going to start teasing children because of that? Oh, because vaccination status has already come up in my daughter's 3rd grade class. You should get vaccinated. My mother said you should get vaccinated, or it's safe. These are conversations that children shouldn't be having. These are conversations they shouldn't know anything about. So if we're going to segregate these kids based on vaccination status, you better make sure it makes sense and it's medically necessary. Because Jess is right. The spread could be stopped if they're all tested. If my child's tested, the child next to her should be tested too, because the vaccine doesn't stop the spread. You all know that. And if it slows it, then fine, but it doesn't stop it. They should be treated equally. And that's really where I am just in this piece of it, because I know that's where we are right now. I mean, obviously we could all go on, but I just really hope that these are going to start making sense in the future for them. Signed to 3rd grade, Mom.
Thank you very much, Katrina. I appreciate your perspective and thanks for joining us tonight.
Thank you.
Appreciate it. Christy, is there anyone else on the list?
I did not receive any other emails this afternoon, so I have no one else on the list.
Okay. Then I will just ask if there's anybody else in attendance who came tonight in order to make a statement to the school committee to please, raise your hand, I guess. Christy, you can see them. Okay. I'm not seeing anything. Are you, Christy?
No, I don't see any other raised hands.
Okay. All right. So thank you very much for contributing your thoughts tonight. The committee is listening to you and we appreciate your taking the time to join us tonight. We're going to move on to the consent agenda, which has 4 items in it. The payroll and payable warrants, school committee meeting minutes from December 14th, the election subcommittee minutes from January 6th, and training meeting minutes from January 10th. Do I have a motion to approve the consent agenda?
So moved.
That was Adam. And then second,
Second.
who was that? Lori?
Lori.
Lori, it was a second. All in favor?
Aye. Aye.
Aye. Mike, did we hear you?
Yes.
Okay. And Julie, did we hear you?
Yes.
Okay.
Madam Chairwoman, if I may.
Yeah.
Any votes taken tonight via Zoom should not be done by roll call.
That's right. You're right. I'm sorry. I forgot that even for the consent agenda. Okay. So in favor of the consent agenda, Julie?
Aye.
Adam, I'm sorry. Aye.
Mike?
Susan, you said there's 4 items. I see only 3 items on the agenda I have.
In the
Am I
folder.
on the wrong one?
In the folder on the shared drive, I think you see 4 items in there.
I see 3. I see Julie's in the same document.
Oh, yeah, we're on the agenda. I think that's what she's talking.
Yeah, but if
Yeah.
you
We have to go
go,
into,
if you go into the consent agenda folder, you'll see 4 items in there.
Okay, so they're not on the agenda.
I'm not sure if they're on the agenda. They may not have been because the election subcommittee and the training meeting minutes came in just this week. Right, so the training meeting minutes weren't on the agenda. That happened Monday. Are you okay with that, those 4 items, Mike?
Sure.
Okay, Lori?
aye.
Megan? Whoops, her audio was off, but I saw her mouth go. Aye for Megan and aye for me. All right. So in the communications folder, there in the parent email folder, there are a couple of emails for the committee to review, and a letter from the nurses, which the committee just received today. And I want to take a minute at this point to just acknowledge that this is Karen's last meeting with us. We are sad about that, but I'm sure you are absolutely elated. We're really proud that everybody in the central office cares deeply about students, but I have to say that if there's ever a district leader whose daily work is to care about individual students and their capacity to learn and have access to learning, it's Karen. It's Karen and her role in the district. It's really significant that somebody's work is to think about the individual and making sure that they have the resources and the supports and the care to for every child to learn. That's just such an important role. So I want to acknowledge Karen's important place in the district and to thank her for many, many years of contributing that perspective and that care into the district leadership team and into our schools. You brought a lot of compassion and empathy into that role as well, which I think is just critical as we consider all the different ways that people learn and can be supported. And when there is creative problem solving to be done, you're at the helm. And we greatly appreciate all the efforts that you've made on behalf of students and the support you've given to staff to help students learn. We welcome Janelle. You have big shoes to fill, we know, and we will certainly miss seeing you in the central office, Karen. So just wanted to acknowledge your important contribution over many years and just open up if there are any other comments from any others on the school committee or from the district leadership. You can make your comments now.
Can I say something, or do you want me to wait till it's my
No, go ahead.
So I'm really glad Karen's leaving. No, I'm not. Karen's been in education for 33 years, and she's been in the district for 10 years. She was some of you probably know that she was the interim superintendent before I got the job, and I always wondered coming in, and people said, superintendents were my mentors, so you better watch out because she probably wants the job. And once I got to know Karen, I realized she was way, way too smart to do this. And that's been proven out in the 4 years I've known Karen. She's always been someone I could trust. One of the things important is sometimes people won't tell you the straight story. She would always be the one I could go to. Others now too, but she was the first one I knew I could go to, and I could say, have I really gone around and bend on this one? And she would look at me and say, yeah, I think you have. I could always count on it too to advocate for the people, for the groups that she oversaw, even if it completely went against how I felt. She would advocate for them, and in her own quiet way, she'd just keep on coming back and keep on coming back, no matter how many times I said no. And she could weigh you down, and she'd weigh you down with logic. So if there's a way to be turned around, that's probably the best way. She's completely selfless. She's Boylston Regional School District through and through. I was talking to her recently. I said, what do you think your biggest accomplishments have been since you've been here? And she talks about the fact that when she first came to the district, that the Department of Education, well, let's say they were a little bit interested in why special ed numbers were so high. And Karen, worked really hard to make sure that those sped referrals came down. And that more importantly, that the interventions were in place to make sure that students were identified correctly, and those who needed service got service. And it's really been the hallmark of our special education department. And you know, we always say people move to the district because our special education department is so good. And that's a big tribute to Karen. Although, even after all that, she said, but that wasn't really me. That was the principals who did that. So, and it was them. It was the principals, but it was also Karen. So I'm going to miss you, Karen. I think the leadership team will miss you. And you're right, Janelle has big shoes to fill. And but we welcome her. So
Yeah, we do.
thank you, Karen. And I'll see you at the lunch we're having for you. It's probably the most important event this week.
Yeah, we were going to give you some flowers tonight, Karen. But I will bring them to the office. I hear Friday is, you're skipping out on Friday, so I'm going to try to get over there before then to drop a little something off for you. So keep an eye out. Anybody else want to make any comments before we move on? All right, thank you, Karen.
I'd like to just say something, Susan, briefly.
Oh,
I'll keep it brief because Jeff likes to talk a little bit longer and he's the boss. So, well, first of all, we don't want to scare Janelle away. Janelle, even though it's big shoes to fill, we're confident you can fill them. And Karen's going to be there to help out through the transition, so don't worry. But Karen has been always a person who advocates for student needs, and as the person responsible for the budget, you might think that could lead to, you know, some butting of heads, but I'd like to dispel that. I know it happens in some districts, but it doesn't happen here. She's able to just outline what the issues are, advocate for students in a professional and friendly way, and we're able to have conversations that get resources that are needed to the students. And we, you know, it's not always easy, but we usually find a way to do it. And she's trusted. She's objective. She will share her opinion. She's truthful. You know that when she's talking about something, she's saying what she means. It might not always be what we want to hear. And she advocates for students, particularly those who have additional needs beyond what might be normal for a typical student. And I've come to respect that. I value her opinion, and I know that I've talked to other administrators and they feel the same way. So she doesn't like to toot her own horn. So I just wanted to be another person who kind of gives her kudos as she moves on. So thanks, Karen. We'll miss you.
Thank you, Bob. Yeah, nice words.
Wanted to say thank you to everybody. It's so nice to hear and just such a wonderful district to work in. And I've thoroughly enjoyed the last 10 years and the team that we work with. So thank you, everyone.
Thank you. All right. We will move on, and I think we're,
Susan,
oops.
just a point. We're getting some feedback on the audio. I think, Julie, it might be your microphone. If you're not muted, I keep hearing stuff coming in. I'm not sure if it's her or someone else.
Okay, let's try that. Thank you. Okay, good sleuthing there. Okay, we'll move into the superintendent's report. I think Jeff will pass it over to you.
Okay, thank you. I'm gonna go over my goals for us. Just a quick update on the first goal, number 1, which is student learning goal. That was the equity goal we talked about. And so we've made some progress on that. And that's really a district goal because the principals are also involved with that. And so are the directors. They all have, you know, some form of a equity goal. But in terms of the action steps, so action steps 1 and 2, we continue to partner with Teachers 21, and we had a rough draft for the equity statement, and our goal was for the leadership team to put sort of a rough draft together and then add the next sphere of equity leaders, which is two people from each school that will eventually become the sort of will help the principals with their equity goal this year, and also act as, you know, sort of leaders in the building. and eventually be responsible for some professional development. So we added those staff on 6th, I believe we had a meeting. It went very, very well. The principals talked about their goals, their equity goals, laid them out. And again, Teachers 21 was there, and then spent a good chunk of time working with the consultants and the 2 new members from each building, and just sort of defining what that goal is and some next steps. And so, so that was sort of action steps 1 and 2. Let's see, and 3. I think I just probably covered that. So that's all going well. And so action step 4 was the piece where I was going to just start monitoring them. So once they get more into their work with their small groups now in each building, I'll continue that process of monitoring where they are with their goal. And if you recall, what their goal was going to be was they were going to have some hypothesis this year of some possible inequity that they see in their building. And then they were going to work on it this year to either prove it or disprove it. And certainly if it's been proven, then the next step next year will be to work on steps to resolve that. So that's the equity goal. And it's, again, it's coming along very well. By the end of the year, by the next time I talk about these goals, I hope to present a equity statement that's been worked on by the entire group, and also some results from an equity survey that we're just putting together right now. We didn't have all of that put together. So once we have that result, you'll see that too. So that's goal number 1. Goal number 2 is the principal walkthroughs, where I would, I meet with the principals once a month, officially at least. There's a focal area, and we walk through classrooms, anywhere between 3 and 6 classrooms, discuss the teaching and learning relative to that focus area. We come back, have a discussion about it, and then the principals have a follow-up discussion with the teachers in terms of what they're going to do, what was seen, some next steps. We did introduce a survey that the teachers will sort of take after each visit to see what the effectiveness of that visit was for them. So that's going well too. This was a goal that I started back in 2019, and we stopped because of COVID. So we just picked it up again, and it sort of just picked it up right where we left off. So, and remember, the focus of this goal is for the principals to increase their visits to the classroom and have some consistent conversations with teachers. So that's that goal. That's going well. Again, that's a continuation one. So, and then the last goal was the professional development goal. So I've begun to attend regular meetings of the Professional Development Committee in Mars, and I've attended some of their professional development opportunities. This goal is going to be a problem because the action step number 3 was to develop a plan to include other staff members beside leadership team and administrators. The problem is, because the way COVID is turning out this year, they've severely reduced again the amount of offerings that they have. So the only thing they've offered so far are opportunities that administrators would be interested in. Like I said, I included myself in a couple of those. I think Carol went to 1 or 2. So that last piece, the plan for including other district staff members, I don't think that I'll be able to do that this year. and unless something happens with COVID, and I doubt that. I talked to Chris Johnson, who's my mentor and is the assistant executive director at Mars. I talked to her tonight before the meeting just to kind of get an update. And she doesn't see how we would be able to turn that around this year. So that's probably one of them. The other two goals, I think I should be able to get everything done. This one, I don't think I'm going to be able to, I don't think I'm going to be able to get a plan in place in which other district members, besides administrators, will be able to attend anything. And they're just not going to be offered. So
Okay.
I don't know what you want me to do with that piece. I don't know what I can do with it.
Yeah, you can, they're not going to online offerings, Jeff?
They are, but they've cut the whole repertoire down, so it's mostly just
Admin.
admin stuff, like they got three really good offerings on budget.
Oh, I saw those, yeah.
Yeah, so they got, and they're really good, but teachers aren't really gonna be interested, and that's all administrative kind of, and principals might, but other than leadership, I can't see anybody being interested in that kind of stuff.
Okay. Can we take some questions, comments from the committee on those three goals, Jeff?
Sure.
Okay, let's open it up to the committee.
I have a question. On goal number 2, it mentions that you would meet with the principals and kind of go over some of what they've seen and assess how they think it's going, what you see from them. I'm curious if you've been able to do that so far. I know it's been a wild ride.
Yeah, I have. We had one round of these walkthroughs already, and I have another one scheduled for whenever Christie's scheduled them. I think they're on the week of the 17th. Is that right, Christy? I sort of just go where she tells me, but I think I have another round scheduled.
Yes, it's the 18th, 19th, and 20th. So
Yeah.
one per day.
And what'll happen if I don't say just schedule them someplace, then they don't get done. So,
Answer
that'll be
your
the
question.
second round. So I'm still on schedule with that. So they should be, I mean, unless something happens, it'd have to be COVID related. I'll be in there every month, in the formal ones at least, instead of just stopping through. Thank you for that.
And other questions from the committee? Megan?
Will we be able to see the survey results
You
when we're
will.
doing your evaluation?
Yeah, you will. I'll present that at the end with the survey and that stuff.
Right. And I just want to remind everybody that those survey results are intended to show your effect on how well the teachers are perceiving the feedback from their principals. So it's an evaluation of your performance, Jeff, not the principal's performance or the teacher's performance.
The other survey we're doing is the equity survey, and that was added this year too. I just forget to mention that. And that was something that we talked about early on, and that's actually part of the goal number 1, to survey the community to just get some information on what they see as possible perceived inequities in the district. We just heard someone speak, and that would be considered an inequity. So it's those kind of things.
Yeah.
And maybe they're just misunderstandings, or maybe they truly are. And so a lot of these things, even when we talk about them in class, it might not be something that's done intentionally. Like I know Diane, for example, is looking at inequities and how students select STEM courses. Now that's a 20-year-old issue at this point. So you're not going to find somebody saying, like, you're a girl, you can't take a math class. No one's going to do that. And that's something that you used to see. But maybe something in body language, maybe in something in, wouldn't you rather take biology instead of physics? Or, I think you'd like this. And maybe it's stuff like that, because nobody's going to do it intentionally, and nobody's going to do it, to get somebody to steer a female away from STEM, but maybe things are still done. So again, that's the hypothesis. And obviously they're seeing something that's happening that that maybe indicates that that should be investigated. And again, it's not to point fingers at anybody. Some of these things just, they evolve over time. So
Okay,
you'll see that too, Megan. You'll have the results of the equity survey too.
great. Other questions from the committee? Okay, I'm glad that you added a community survey around equity. I think that should be interesting and revealing, I imagine. I
Yeah.
look forward to hearing more about that. Okay, moving on. And your report, Jeff?
No, I have, what else do I have?
COVID update?
Oh, yeah, COVID update. Yeah, just a few points here because there's been a lot, over the vacation. And I'll just talk about the things that I've received questions on, or things I've had questions on. So the first thing is on what's considered fully vaccinated. So even though the Department of Ed and the Department of Public Health recommend a vaccine and a booster, that's not what they're considering. That's not what's considered fully vaccinated. Fully vaccinated is still considered 2 Pfizer shots or 2 Moderna shots, and then a 2-week period after that, or 1 Johnson & Johnson shot, and then 2 weeks after that. So it says it in the guidance, but I think some people are still thinking that the boost is included. It may be sometime down the line. The other big piece was the time of quarantine, and that seems to be, well, obviously an issue with parents, but that issue that a student only has to quarantine for 5 days and then come back, even if they test positive, they can quarantine for 5 days, and as long as the symptoms have been resolved, then they can return back to school, and they have to wear a mask for the next 5 days. So that's tied to something that happened with the testing and the mask. So returning to school is not dependent on a second test. So it's dependent on the amount of time you're out, and that 5-day duration, and whether the symptoms have resolved themselves or not. It's not a second test. And so what happened over the vacation was, just out of the clear blue, this is something we didn't know before vacation, the Department of Ed reached out and said, we have these tests for you to distribute to faculty, to staff. And each kit has 2 tests in them. So you're going to give each faculty member, based on a voluntary basis, you're going to give each faculty member 1 kit that has 2 tests in it that take, whether they're symptomatic or not, they take 1 test, and then the next day they take another test. And they said, okay, you can pick them up. And then they came back and said, well, we don't have the test, so don't pick them up. Within 8 hours, they sourced more tests and said, okay, now you can pick them up. And fortunately, Bob lives in Millis. I didn't want to give that away, Bob, for all your fans, but Bob lives in Millis, and the tests were picked up in Franklin. So he was good enough to go out on that weekend on New Year's Day and pick up the test, brought them to Berlin Memorial. And so at that point, the Department of Ed said, we don't have enough tests. So you can't give the whole kit. You got to break the test out. And I'm thinking to myself, well, that's not going to work, because now we've already told them they have to take 2 tests, 1 to confirm the other one. And now we have to handle their test. And so some people aren't going to like the fact that we got to handle their test. And the union sent me, the association sent me this. And I said, once I knew we had to break the test up, I said, well, like, people are going to freak out if we touch the test. Anybody who wants to test twice probably isn't going to like that I'm going to touch the test. So I said, well, let's hold off and take a head count. And if we have few enough people, we can give them the whole kit untouched. They can open it themselves.
This is voluntary, right?
Because it was voluntary. And it turns out we did have to break them up. And so I got questions like, well, what do we do for the second test? I'm like, well, the second test is off the table now because they didn't give us enough. And, you know, you get one test and then you can then take the other test later. Like they just changed the rules and said, well, we don't have enough of that. So they asked me what to do. And I said, listen, I don't know what to do with this. If someone gave me just one test, I'd wait till I had symptoms, but consult the nurse or do however you want. It's your test. And I think it's just something that happened with the department. They were told to do it. Within, you know, one day we were told, you know, you got to pick all this stuff up. And then there was another question about the mask, these KN95s, that they were going to provide enough KN95s for all teachers to wear one a day for 2 weeks. So, but they prioritized who got the mask. So we were supposed to prioritize teachers who were face-to-face with kids. So, you know, we distribute these masks. We had 1,000, we got 250 in each elementary school, 500 in the middle high school. And the principals, being good principals, say, well, I'm not just going to make it available. I'm going to make this available to everybody. Everybody's in there. Everybody should get a shot at these masks, which means they don't have enough masks now. But again, so we then ordered 2,000 more because Bob gets them for 3 cents a piece from, I don't know where. I don't know where he gets them, but he gets them from someplace. And so now we have enough for all of the teachers who want them to the end of January, one a day, if that's what they want. And given the amount that are still sitting in Bob's office, my guess is they don't all want them. So I think we were done. So I don't know where it came from, this thing from the Department of Ed, but we've done the best we can to sort of at least enforce it, enforce the spirit of what they were trying to do for us within what we could do. So that was the deal on the masks. We have enough.
And student masks, Jeff?
We do have student masks. I don't know what the count is on those, but we bought some early on and we put them in the schools. But the reason we put them there originally is because the original guidance from the Department of Ed said that if a kid lost the mask or, you know, got something on it or something happened, they didn't have one, then we should have some. Again, it was voluntary, but we should have some in school. So we have them there. I mean, they don't use a lot of them because, you know, they like to wear the mask they like. So we have them there. I don't know what the number is, but certainly enough for, we haven't run out of them for sure. That's for sure. So that's the issue on the testing and the mask. That's what happened. I think we're all set with it. We have been having some issues. I mean, I think one of the issues that's happening across the state is the amount of work that the test and stay has caused with these close contacts. I know we've had nurses work till 8 o'clock at night. And I mean, I get that. But it's really not just us. It's happening all over the state. And I think I have it on, you know, kind of semi-good word, at least, that the commissioner is, or the Department of Ed is at least considering some modifications of, you know, test and stay, who gets tested and who doesn't. And that's probably not going to make Jess happy. But I do want to remind the committee that there was a vote that gave me, as superintendent, the permission to follow DESE regulations and not go above and beyond or not do less. And so until I hear different from the committee, that's what I'll continue to do. So if it's a 5-day quarantine, then that's what it'll be until somebody tells me that we have to follow a different policy. I know, again, you know, we got some letters from the nurses and some concerns, but, you know, the Department of Ed follows Department of Public Health advice. And so that's what we've been trying to follow to the letter. Just so you know, we haven't deviated from what you've asked us to do. I will say we're at about 10% of our staff and our students who are out because of COVID, which isn't too bad considering some other districts, but it is getting difficult to cover classes and get substitutes. We're hoping we're seeing the spike of that and it's starting to come down the other way, but we will see. And of course, you know that the mask mandate has been extended through February 28th, and that's the last word on that. So I suspect that either this week or early next week, there'll be some additional guidance on test and stay and who gets tested and the close contact piece. So I don't know if anybody else has any questions about it.
Do you want to say any more about the letter from the nurses and how you're approaching the issues raised there?
So we just received that. I really just, and I was going through my email and, you know, there's a lot in it. It's like 5 pages. So, you know, I have to go through each point. You know, obviously they're concerned. They do a lot of work. At the same time, you know, I feel that we've provided a lot for them to do the job this year, and I'll have to go through each point to see. Some of it's really policy related. That's really not in my realm, and then some of it is just stuff that's, you know, just budgetary stuff that I'll have to just make a decision on. But what I was thinking of doing is going through each bullet and then just present to the committee. Even if it's something that doesn't have to do with me, why should that stop me? I'll make a recommendation and then you can vote on it, you know, the way you feel you should. But so I don't know if we're gonna have a special meeting for that or a second meeting, but I should have something within, like, you know, within a few days to a week. That I have to do a little research and talk to a few people also on some of those points to make sure I have the right information. And again, some of it's just decisions I will just make myself, and I'll let you know what I decided on. Let's see. I will say that in terms of, and this is just I don't have any numbers, only what Karen and I have talked about from her conversations with the nurses. And I think actually you did Susan, you put together a nice graph here. Many of the cases we're seeing, you know, we haven't seen, you know, one of the questions that I asked is, you know, one, do you track the number of, are you able to track, and I know this is difficult to do, are you able to track the number when you do test and stay, how many kids who are close contacts are actually positive, which would indicate there's transmission in the schools. And it's actually, in Karen's words, I can quote it because she's retiring. There's no, she says it's a handful. And we've done hundreds and hundreds of test and stay. So the transmission, and it sort of supports the research that we've seen come out, that the transmission, we used to think that schools were places where there was a high transmission rate, and they're really not. You know, we haven't seen a high transmission in the schools. And I don't want to refute what Jessica says. One, because she's on my superintendent advisory now, and so I like her. And I think she makes some good points, but we're just not seeing that kind of transmission in schools. If the test and stay is any indicator, and it's probably like 15 other different variables that I don't know about, but purely just talking about test and stay data, only a handful of the kids who were close contacts, based on someone who was positive, have actually been themselves positive. So most of our test and stays are close contacts. turn out to be negative. And again, I don't have a number to support it except just, for the nurses kind of feel about this.
All right, I just want to read the line from their letter that states almost every positive student was originally a close contact from a person who was positive living in their home.
Yeah, I mean, I don't know if it was in the homes. I mean, that's something, I don't know how you could tell that. It could be their buddy or something else, but not school. Yeah. Yeah. I
Okay,
remember, Susan, if I could, I remember you sent an article, this was last year, and it talked about schools being mass spreading environments. And then, within a couple months, there was a lot of data that came out that said that that's really not true. And certainly the data we have, and again, the nurses just said it there, that it's not school. I don't know if it's at home, but it's not as much in school.
yeah, I mean, we'll need to continue to watch the data as it comes in. The chart that Jeff was referencing was that I took the numbers from each day last week, Monday, on the first day of return from vacation through Friday by school, and looked at how many kids were being identified as positive cases each of those days. And it was, and Diane, you can correct me, it was something like 30 students on day one who were identified positive at Tohoto, which suggests that those were not cases that were spread there. They walked in the door with those cases. So we have to really watch to see what happens with these numbers over the next couple of weeks. Hopefully, we'll track these closely, and Megan's doing a great job keeping the COVID dashboard updated each Monday. I just want to reiterate that's a task she does every Monday based on the data from the previous week. So let's open up any clarifying questions or comments. Lori?
Jeff, I've asked you this before, and it directly relates to DESE's guidance. Are we keeping track when we get positives as to whether they're vaccinated or unvaccinated? I know Katrina Lawton spoke about, the discrepancies between the two, and I'm just curious, as we edge closer to 80% at Tohoto, and we're talking about equity, if we're watching the numbers to see if there's any truth to or validity to that.
I don't think we are. Karen, do you know if we're keeping track of who's vaccinated? I think I asked you this question because you've asked me this before, Lori. I think I asked Karen this, and I think she said no. Am I correct?
We're really not, because when they're testing, they just don't have the time to go back and find out who's vaccinated and who's not. It's good information if we can find a way to do it.
Understandable. Thank you, Karen.
And is that vax data still being entered into the system? I mean, the backlog of information being entered into, is it called SNAP or something? The new system that nurses are entering vax data into? Is that right? Am I right about that? That they're
So it's not going into SNAP. It's actually a state system.
Oh, okay, sorry.
And SNAP will be able to read that eventually, but we've had a snag because the state is so backlogged. SNAP has not been able to get them to make that connection. So we don't have that available, even though we've got the SNAP up and running. We're still trying to get that state connection in place. So
when that's in place, you'll be able to see vax and COVID, the relationship there.
We'll be able to see very easily. We'll be able to pull the numbers of who's been vaccinated in the school.
But what about the relationship to being ID'd as a positive COVID case? Can you?
There won't be a direct, no direct correlation. For that.
I was hoping maybe that pulled up all the same information on one.
I think one of the things we don't realize is that tested hundreds and hundreds of people now. I mean, they're just inundated by it. And so, I mean, I think at this point, they barely have enough time to just get the testing done. And so I think they're just collecting the bare minimum. And I don't, I had this, we had a discussion, the AVC superintendents about this and about, test and stay and the close contacts. And they're all experiencing the same thing. And nurses really having a struggle and trying to keep up with this. but it's the same thing. They're only collecting just the kind of the bare minimum, the bare minimum amount of data. I did want to say that the Department of Ed released a new flow chart for the new mandates that I will send out to the public. It's a little easier to follow this than it is to all of the wording. So, and this will probably answer some questions in the community.
Okay, now, any other questions, comments? Mike?
Yeah, thanks, Susan. Jeff, I just want to say, I know it's been a tough week and a couple of days there, but things seem to be going good from our perspective, given everything that's involved. Our daughter comes home every day excited about school, and things seem to be going well in her class. So just want to say thanks for that. I know everyone we hear from these days, health professionals, everyone from President Biden on down, says how crucial it is to keep schools open and that they're some of the safest buildings in the country right now. So it's a good job, and I just want to say thank you.
Thank you. I appreciate it. And, I do want to say and that's one thing I forgot. I know there's this push, at least part of the community. I've heard some parents, especially in light of the new quarantine guidelines, say, when are you going to go remote? And there are no plans for that. And even if I wanted to, if I said today we're going to go remote, the students would not get credit. They would not get credit if we went remote. So even if we wanted to, we're still tied to the Department of Ed guidelines. If they don't want to give, let's say we do it for a week. I think sometimes that the public thinks I can just close down a school for a week, but there's this entire agency, and that is just like if you decide and I decide, then it happens. But there's this whole agency there that determines whether we get credit. If I decide to go remote for a week, that's 5 days we have to make up. 2 weeks puts us into July. So I think people don't realize that, I just can't do that. So again, we get about 10% out where, we're hanging in there. It hasn't been easy. I know the teachers and the nurses are doing a tremendous job. But I'm just hoping that we're getting over that curve and we see the other side of it soon.
Okay. Megan, you had your hand up?
Yeah, I was just wondering, how long is it taking? Like Tohoto had 70 cases last week. How long and how many children or how many kids are in test and stay? How long is it hours? Is it 1 hour? How long are we having kids sitting in this quarantine area waiting for their nasal swab in the morning? Do you know?
Karen might know.
Oh, I can answer.
Generally, each group has gone, each school has gone within an hour because they actually have to get to the next school within an hour. A lot of the numbers that you're hearing are kids that have also been called in as a positive by their parent. We're not testing necessarily all of them. So
see, so they're just waiting, you mean?
they've been busy. They've been busy for sure, but usually they're about an hour each group.
Others? Adam?
Yeah, so two things here from my end. One of them is first one on the test and stay program. I did see an article about a change being made in the state of Vermont where they're going to allow, it appeared, the test and stay to be conducted by parents and done at home, as opposed to putting that burden on the nurses. Now, I think you mentioned talking to other superintendents and expecting a revised guidance from DESE on this. Do you think that's a direction we might be headed, where the burden to test for test and stay will be off the nurses, but onto the homes to do it?
Yeah, it's a possibility. You probably don't remember before you were on the committee, but when they introduced the original test and stay, the original concept, they gave us kits, these test kits, and we had the option. There was some option where we could either have the student come in and we would test them, or we could give them the test kit and they could take them home and they could test in the morning before they came to school. So that wasn't last spring. It was the first spring of COVID. I kind of even lost track, but it is a possibility. So That's one of the things, or, a couple of districts have just said, we're not doing it anymore. It just takes too long and kids are gonna get this thing and that's it. And Ashland did it, and I think, if I'm not mistaken, Amherst Public Schools did it also. So, and again, there's a push by other superintendents who are seeing like so much time being taken up that they're starting to think about, like, how much are we really getting out of this for the time we're spending? But I think that's definitely a possibility, Adam.
Thank you. And I think back to some of the comments that were made publicly here early in the meeting, I heard, Ms. Lawton mention in comment that, it doesn't appear that vaccines are stopping the spread, right? And her question around whether the vaccinated children should be in test and stay. And then, even Jessica was saying, COVID's airborne, right? And I feel like sometimes we're still abiding by policies and practices like a 6-foot rule that is outdated based upon what we thought was the case in May of 2020. And clearly, I think to many of us isn't anymore. With that, I want to kind of shift a question and talk a little bit about the masking requirements and the recent extension of those requirements from Commissioner Riley. So I'm disappointed with how this has been continued to be mandated upon districts without really any local decision-making authority until you get to that 80% vaccination mandate. And if you are at 80%, even then I question myself whether 80% vaccination has any impact on preventing transmission of COVID within our schools. So when I read the press release that came out from DESE earlier this week announcing the extension, what I notice is that they're providing no evidence of efficacy within that press release for either masks or that vaccination off-ramp. And so I'm interested in seeing the evidence that they're using to decide to continue to put that policy in place. And I prepared a motion I want to make this evening. And I don't know, Christy, if you can pull it up and I can speak to it.
Hi, come on.
Do you have that within reach, Christy? Because I can get it if you don't.
No, I don't have that handy, sorry.
Okay, hang on one second.
Yes. And so while she pulls that up, I'll just comment and say, my interest here is in understanding the evidence that's being used to continue to require masks within the schools. I think that it's a question we should be asking when it's being put onto the district by, state organizations that aren't providing it. So just a little background on what I'm thinking here. So on January 10th, Commissioner Riley extended the requirement that all public school students ages 5 and older in all grades and staff be required to wear masks indoors in schools, except when eating, drinking, or during mask breaks. This is the third time they've extended this mask requirement and now continues through February 28th. The only rationale they give is that the mask requirement remains an important measure to keep students, teachers, and staff in school safely at this time, without citing any sources or research that indicates either of those things work. So the only off-ramp for a school to lift the mask requirement is through DESE's vaccination threshold policy. The policy allows for a local decision if a district can demonstrate the 80% of all students in a school, students and staff in a school have been vaccinated. They haven't provided evidence that either masks or vaccinations prevent the transmission of COVID-19. And I think a couple of people spoke to that earlier in particular. So I'd like for our committee to take this up and to begin a process towards revisiting and discussing our own mask policy. I shared this with Susan prior to the meeting, and we got some feedback from Russ as to open meeting law and how we can kind of line this up. But what I'm looking at here is a motion that I'm going to make at this time that we add an item to the agenda for our January 25th meeting that authorizes the district to send an official letter to Commissioner Riley requesting evidence be provided to demonstrate that masking students and or achieving an 80% vaccine threshold prevents the transmission of COVID-19. That letter would request a response by February 25th, 2022. Furthermore, that we add an item to the agenda on March 8th, 2022 to review the district's mask requirements. So that's the motion I'd like to make at this time.
Is there a second?
I'll second. Lori?
That's Lori, thank you.
Yep.
Discussion.
Yeah, so just taking that back, Susan, I think that we came to a realization in talking or corresponding with council tonight as to how we should move forward with this. And so I think that we're not necessarily going to discuss, we're not going to discuss the actual letter or sending it this evening. We're just talking about adding these two items to the agendas as indicated here. And that's the extent to which I have a comment.
So you see the two pieces there, that an item be added to the agenda on January 25th, and that an item be added to the agenda for March 8th. That's what we're voting to approve, that these items be placed on these agendas. And then at those meetings, we can dig in and discuss and deliberate. We can't today's meeting because our agenda did not announce that there would be a vote on this content, and there was no mention on our agenda of anything, a vote on anything to do with the mask mandate. So in terms of the open meeting law, the public would not have known that we would be making a significant vote on a matter that might make a difference to them. They might either want to weigh in and public comment, or to attend or listen to the deliberations. So that's why the conversation is pushed forward to the February and March meetings. Adam?
Does that just go on to say that, and then at the January 25th meeting, when we would discuss whether to send that letter is very simply, according to the motion here, requesting that the commissioner provide us with the evidence that they've used to demonstrate that masking students or a vaccine threshold prevents the transmission of COVID-19. If that evidence is available, I'd love to see it. And so I think that's what we're looking to put forward and discuss on January 25th.
Okay, any other discussion? So all of a sudden I can't see people on my screen, so.
Susan, I'd just like to comment. Thank you, Adam, for writing this. It's Lori. I think it's very well worded. We're just looking for clarification. And I think it's important that we get that, because there's a lot of science out there, and I'd like to know what DESE is using to make this decision. It's an important question. So thank you for doing that. I appreciate it.
Anyone else?
I was gonna say, it's Megan. I was gonna say the same thing as Lori, that Adam, thanks for taking the initiative on this. My only concern is that we don't get any information back from DESE, and they do continue to extend the mask mandate. I don't know if school committees can override DESE mandates.
And so Megan, that is exactly, we would discuss that when we go to discuss these on both these dates here. That's when we would deliberate about that issue.
It's gray areas. All right. Okay.
Yeah.
Susan, I'll just make, if I can, I don't know if you can see everybody, I know the sharing makes it tough. Megan, on that note, the dates that are in my motion were selected on purpose, given that there's going to be another DESE update for that February 28th timeframe. So we're seeking the evidence prior to the next announcement of what they're going to do with the mask requirement, and then basically setting ourselves up to discuss that on March 8th, at which point we'll know what they've put in place for a policy or a requirement for February 28th and beyond.
Yeah, Susan, can I just wanted to say thank you. Adam, I just wanted to say thank you too. And I think just on the dates, I think that was really thoughtfully done, how you put those two response dates in there. So thank you for thinking about that too.
Thanks.
Okay, anybody else? All right, so hearing no more discussion, let's do a roll call vote as to whether to approve the motion as presented here, that items be, these particular items be added to the January 25th, 2022 meeting and the March 8th meeting as specified here in this document. I can't see people, so I'm going to go a little choppy here. Okay, Mike?
Yes.
Where's everybody? Sorry. Lori?
Aye.
Megan?
Aye.
Adam,
Aye.
Megan, did I do Megan?
Julie.
Julie, thank you.
Aye.
And
Aye.
I am an aye as well. So that passes, and these items will be added to upcoming agendas. Thank you very much for your work on this, Adam, and your flexibility as we worked out some kinks in terms of what we could do tonight and what needed to be done at future meetings. All right. Okay, so I think that finishes up your segment of the report, Jeff, and we're ready to move on to Bob's report from the business office. We can't hear you, Bob. No sound.
There we go.
There we go.
So I have a couple items to report on. The first is an update on the FY22 budget status through January 5th, but essentially Q2. That was posted on the Google Drive for the school committee to have access to. A lot of the, most of the significant budget transfers are similar to Q1. There's comments on the second page describing what's led to those adjustments. So I won't go through those in detail. I just thought I would take a minute to just provide a brief reminder about the report and encumbrances, because encumbrances is a little bit different from typical P&L outside of school finance. So we record encumbrances against the budget for things we know we're going to spend when we've set up a PO and we haven't yet received the services or purchased the goods yet. They haven't been delivered. So the encumbrance sits there until the bill's been paid. We don't want to think that those budgeted funds are available. That's why we do that. We do that similarly for payroll. Once we start the year, we basically know who our staff is and we can encumber their full salary throughout the year. So when you look at the encumbrance column, that's what that represents. There are a significant number of things that happen that we we purchase, whether it's equipment repairs or things that we don't necessarily anticipate. So there are additional expenses throughout the year. You'll see some, what look like significant budget balances. Where we are may appear healthy, but there's things that come up in the second half of the year, and we typically end up spending that down. We intentionally lag our technology purchases as a safety net in case something else comes up. So a lot of our technology costs, which are in the teaching and learning or instructional area, have not occurred yet. That's kind of a background on in terms of what we look forward and project. We do anticipate spending down nearly all the budgeted funds. I also, related to this Q2 update, I got information just today that's not included in this that indicated that we're going to have an additional $80,000 in expenses for school choice and charter school tuitions beyond what we have budgeted. This includes charter school. We basically pay a tuition rate. We had a student move into Boylston from another town, and they're attending a charter school. So they've never even attended our schools, yet we become fiscally responsible for that when they move into our town. So that's one student. We've also seen an increase in students attending the virtual academies, likely out of concerns about COVID transmission. So those are the two main drivers of the increases. I will say, other than that, it is fairly steady. Most of our students who go to charter schools go to AMSA. In school choice, we really don't see that many leaving relative to what we take in. And there are some that go to Hudson and a couple other local communities, but we typically take in a lot more school choice than we send out.
Just for
so that's the update on. What's that?
AMSA is the Math and Science Academy in Marlborough, is it?
It is. It's one of the top rated schools in the state. I think one of the top two. So that's the Q2 update. we're not providing an FY23 budget update. There's a lot of moving parts and with what we have on the agenda. The thought was we're going to be presenting in the first meeting in February, so we'll kind of table the FY23 budget discussion until that meeting. And the last item I have is the excess and deficiency update. Excess and deficiency is for a regional district is like free cash for a town. The state has been a little bit slow in reviewing these. We submitted it back when it was due, I think sometime in October, late October. They still haven't reviewed it. They tend to prioritize town submissions related to free cash and tax rates before regional districts. I'm told that it'll be reviewed soon. So as soon as that's been reviewed, I'll present it at the next school committee meeting after it's been approved by the state. And that's all I have.
Questions? Thank you very much, Bob. All right. We're going to move on to Carol, Assistant Superintendent for Teaching and Learning update.
Good evening, everyone. I have two items in my report this month. I wanted to follow up on what Jeff was talking about with the equity work we're doing in the district. As he mentioned, we've been partnering with Teachers 21 consultants. We had probably, I think, a breakthrough meeting on January 6th when we had invited staff representatives from each of the three schools into this meeting, and it was very dynamic. I want to thank those folks who are working with the principals to represent this work in their individual schools. I think it's going to make a lot of a difference to have them on the ground, really working around the culture of their schools and exploring with the principals obstacles, I think, to equity in terms of educating all of our students. That's really what our focus is around the educational piece here. I also, just to tag on to what Jeff was speaking about, I also wanted to mention with that equity survey that Jeff and I are putting together a series of questions for that survey, but we're also going to be introducing that when we work at the superintendent's advisory council meeting. And that group will help us, I think, formulate those questions so that they'll really speak to the parent community when we send that out. So we look at it really as a whole school community effort, district community effort to really focus on what's important in our schools as far as educating every single one of them. And that speaks, I think, as you mentioned earlier, Susan, to Karen's work in the district. There's so many things I wanted to say about Karen earlier, my next door neighbor for many years. I'll miss her tremendously. So, but she really was just a champion of our children individually. And that's the work we're trying. I think the greatest tribute to Karen will be to successfully follow up and do the best job we can on equity for each of our children. So the other piece I wanted to mention was the early release days. That's Wednesday, it's tomorrow. This is the second of our early release professional development days. We have 4 full ones, and this is that second one. We try to do a lot in 2 hours of time. The elementary schools are going to be continuing to focus on their literacy work, the early literacy I spoke about before, and also the piloting that's taking place in grades 3 through 5. We'll be making a decision around that pilot in March. So it's really imperative that we have the training with the publishing company and have the subsequent conversations among those folks who are piloting and myself. We have Joey Flournoy is going to be leading the group that he's working with on mathematics at the elementary school. And at the high school level, we have the teachers continuing to work on their curriculum alignment, but also there's some trainings going on as well. And I also want to mention that there's a new group working with the Bright program out of Brookline. And the Bright program, the purpose of that, they partner with the state to bring tools and framework for and networking connections for counseling services, for a transitional bridge program for students who are coming back to school from health related issues, both mental health, physical health issues at the high school level. So they work with our staff at the high school to create those transitional programs. And they also work with the elementary schools, particularly with parents, to bring resources to parents who are struggling, particularly in these difficult times, and working with their children at home. So we're excited to have the Bright program on board. I had written a grant around that. We're waiting for that, the results of that to come in. But in the meantime, we made a decision as a district to go forward and to have this the Bright program come on board with us. So we'll be meeting with them as well tomorrow. So a lot happening tomorrow in the 2 hours at both schools. So we thank you for that time given us to be able to have those concentrated conversations among educators. So thank you.
Yeah, thank you. Thank you, Carol. Any questions or comments? Laurie?
I just wanted to say, Carol, I'm so thrilled about the Bright program. I've heard a lot about it and I feel like we would really benefit from it. So I'm incredibly grateful that you are writing a grant for it and already ahead of the curve. Of course you are. So thank you.
You're welcome. Yeah, no, we're very excited about it too, Lori. Thank you. Glad to have them on board with us. Grateful.
Any others? All right, thank you, Carol. Great to hear that update. And we'll go to Karen's final update. I feel like there should be balloons or something.
Thank you. I wanted to give you an update, even on my update. So I wrote you the numbers of test and stay as of the 5th. So here we are about a week later. As of this morning, we've completed 1,272 tests, and we've had 51 positives. So you can see a big increase with our test and stay this week. It's been quite an increase for the nurses. They've been really busy. They've been doing a lot of contact tracing. That's really what's consuming their time. And they've been doing it down to nurses this week. So it's been a challenging week for them. And I think you heard some of the stress in their letter that they're feeling right now. So I wanted to share that with you. And I also put in something. I think I like to look at data every once in a while, and I decided I would share it just because I thought over the 10 years I've been here, it's some interesting data to kind of see where we were and where we are. And I pointed out a few things that I thought you may find interesting. I think you can see the work of the principals in getting some early intervening services in place by the decrease in the special ed numbers that were quite large that first year in Berlin has really decreased over the years. I think there's also some interesting numbers that have changed over the last 2 years since we've been a district. Our high needs population has increased, and it's really not the special ed numbers. When we break it down, it's really our low income numbers that are increasing. And I think that's pretty obvious over COVID. There's a lot of families that have lost jobs, but it's an increasing number and something that we probably want to keep an eye on. And we've also increased our diversity in the district. You can see that over the last 10 years has been increasing pretty steadily. From year to year, it's not huge, but when you look at it over a period of time, you can see quite a difference. And then the last one I had there, I'm glad Diane's here, but look at the increase since she's been principal for the graduation rate at Tahanto. It was always good, but now it's really great. And that particular rate is the 4-year graduation rate. Some students take 5 years to graduate. So that's even higher when we look at that rate. So I just wanted to share some of that. I think it's interesting sometimes to look at our data and where we are.
Yeah, that's a good point to be doing that. Questions or comments for Karen? Adam?
When I hear 1,250 or so tests completed, that's one way to put it. But every test completed is a day a student was able to be in school when they otherwise wouldn't have been able to prior to test and stay. And so I certainly understand the stress and the burden that's on our nursing staff right now, but I think they should understand, and I want them to understand how much we appreciate the work they are doing to keep those students who are negative in school when previous policies, quarantine requirements wouldn't have allowed us to do that. And so kudos to you and to them for, saving 1,200 days of school. I think I heard the governor say statewide, it's been something like over 300,000 days of school have been saved in the state this year because of the program. I think that puts us, I think he said, the highest in the country. And so that's phenomenal.
And I absolutely agree with you, Adam. And when I talked to the nurses this week and we talked about the headlines of districts that are getting rid of test and stay, and that was the first thing they said, look at all the kids that have stayed in school because we're doing this, as crazy as it is. So I think they agree with you. They're just struggling.
Totally understand.
Yeah. Anyone else? Thank you very much, Karen. I think we should be able to say, okay, you can go now. Lights out for Karen. You have to stay to the very end, but okay. We appreciate you being here and giving us some summary of data like that at the end of your stay, because it's particularly meaningful to see the progress that's been made as you transition over and Janelle fills your shoes.
Hey, Susan, just before we leave, I just do have one question, if I could. You talked about economically disadvantaged student population increasing, and also you have race breakdown in here as it relates to equity work. I'm just trying to find out, or just understand better, why do we track race, care about race? Do we treat race differently in the school when it comes to supporting students? Why is that a significant issue here?
I think it's all about equity for everyone. Do these students feel that this is their school, or is it a school where it's predominantly white? Do they feel comfortable in this school? So a lot of our work is around how do we make these students feel just as comfortable as the more predominant race in the school. So that's where a lot of the work has been. And do we
Has that historically been an issue in our district?
Has it been an issue? I think there's been issues. There have definitely been issues at times. I don't think it's a huge issue by any means, but there's definitely been issues.
Okay.
Okay. All right. Thank you. Karen, thank you very much. Let's move on to Paul and technology.
Good evening. Can everybody hear me okay?
Yes, thank you.
Awesome. My report is very brief, and it's really just an update on some data I had given you in September. Some of the stuff that we were behind on because of supply chain issues was able to be completed over Christmas vacation. So the last 3 days of break, we were able to get 6 rooms at Tohoto, new boards, as well as 2 at Berlin and 2 at Boylston Elementary, and as well complete some repairs that were overdue at Tohoto in 2 additional rooms. So we were able to move some classrooms forward with interactive boards, start our replacement of those that are beginning to fail, and really try to again get every room back to where it should be. So that was good news. I did mention Dave McCarthy, so I do want to thank him publicly during the meeting as well for giving up a lot of his time to make sure that we could share some of that vacation time, but still be there to cover the vendors. And I didn't mention in my written report, but I'd like to thank Sean Kilcoyne at Tohoto and Mike Wilson at BES for doing some prep work and making sure rooms were available to the vendors and making sure doors were unlocked and they had access to where they needed access. So Dave and I didn't have to try to run around to multiple buildings all the time. So, any questions?
No, I just imagine that was really nice for those teachers walking back into their classrooms at the beginning of a fresh year to feel like their technology was working and they could use that for effective instruction. So I appreciate all the extra effort when everybody's on vacation to make this happen and get the rooms, get the technology ready for students.
Yeah, and again, we tried to do the least disruptive. And typically we're doing this work over the summer when we can, again because of supply chain issues that didn't happen, but it was good to get done. varying, a lot of happy people, some people who are now like, well, where's mine? And that's good too. That's always good to hear. So we're excited about that.
Right, that's great. So what's the timeline or plan for getting to the rest of the classrooms then? I'm speaking for those teachers who are saying, when's mine?
So again, as part of a 5-year cycle, we're trying to, again, update all of those. And again, a lot of that is a pending budget. It's going to be another tough year.
Yeah.
So again,
Well, Jeff was just saying you hold the technology expenses till the end a lot.
Oftentimes, because again, in ways, where we're always trying to stay ahead. So, we're trying to always keep rooms. And again, had things gone well, we wouldn't have been in this situation where we had actually 3 rooms that didn't really have fully functioned boards to start the school year. And again, we would never want to be there if we could. And so we're always trying to stay ahead. So we're always replacing things that, maybe a tiny bit before they need to be replaced. But sometimes, again, as Karen can attest to on her way out the door, special ed expenses sometimes come up, or other priorities that, that come up. But again, because we're, trying to stay on top of it and stay ahead of it, technology sometimes suffers because of that, but it is what it is.
Yeah, I appreciate it, Paul. Thanks for your efforts on everyone's behalf here.
You're welcome.
All right, we're over to Diane, who's been waiting very patiently. Usually the principals get to go ahead of this somehow. It feels like you've been waiting a long time. So thank you for hanging in there.
Thank you. I'd like to thank the committee for, allowing me to do this presentation during this school committee as opposed to last school committee. I was able to see my son perform in his choral concert, first time in 3 years. They just always happen to be scheduled on school committee night. So I truly appreciate you allowing me to move this. I'm going to first begin by presenting the school improvement plan. And again, the school improvement plan, comes from the district improvement plan, and the school improvement plan is developed with input from our school council, which is made up of administrators, teachers, students, as well as parent representatives. And so our first goal is to, as Carol had mentioned, strengthen student achievement by advancing curriculum opportunities and updating our curriculum. Over the past couple of years and continuing this year, our goal has been to build our STEM program, namely our computer science program, with a grant and partnership with the Department of Education. We have been able to implement a computer science discoveries pathways in middle school at Tohoto. So now we have a pathway for students in 6th, 7th, and 8th grade. All students are required and have the opportunity to take a computer science discoveries course that is taught by our new librarian, Jocelyn Charpentier, as well as 2 years ago, Tanis Wood, our physics teacher, built and designed a computer science principles course at the high school that is not only a course for students regardless of whether they're a honors student or a college prep student. They also have the ability to take a AP computer science course. And so we've been working hard with that as well. And as Carol stated, the teachers are working on the curriculum mapping and development into Atlas Rubicon. And I'd just like to add, some people wonder why it is taking us so long to input our curriculum into Atlas. And the reason for that is most high schools, they have teachers that teach maybe 1 or 2 different courses in a year. And, you know, you may have a teacher who teaches all Algebra 2 and maybe a pre-calculus is thrown in there as well. So they really have 2 preps. A lot of our high school teachers teach 5 different courses in one day. So that curriculum, one teacher can be responsible for putting in 5 different curriculums. And that is, you know, a significant feat. And oftentimes they're singletons. So they do not have a colleague to share the work with. You know, we have one teacher that teaches pre-calculus honors. So they are solely responsible for inputting and updating that curriculum into Atlas. Versus, you know, oftentimes in other schools, there are 2 or 3 teachers that may share that. And they'll break up the units, but we don't have the luxury. So that is really why it you know, it has taken so long. And then, you know, our focus is on our core content classes. Teachers also teach electives. So they're working on inputting those into Atlas as well. Another area that we've worked hard on developing curriculum and, you know, being able to expand our opportunities within the music program is, you know, the performing arts. We have over the past 2 or 3 years, even during COVID, we have developed a drama program in which the students actually were able to, you know, do virtual plays. Just right before Christmas, the drama program was able to put on presentations for the preschool as well. And the preschool kids loved it. And I think the high school kids loved it, you know, even more. So we are continuing to work on that. Our, you know, communication with our family community outreach. Again, there is so much information, you know, with COVID, there's so much information to keep parents up to date and abreast of the situation. I think our teachers are doing, you know, an excellent job with the fact that, you know, we have students that are basically, you know, they're in class, they're out of class, in class, out of class, depending upon quarantine or illness, et cetera. And teachers are, you know, communicating very well with their parents, as well as keeping websites in their Google Classrooms, those who use them, updated. So that is, you know, a continuous goal for us as well. And Sally Stuckel's our assistant principal. We were able to run a parent camp, although we had to do it at the very beginning of the school year for our 6th graders. The plan is, I think, Carol, is it June 13th, or I believe is parent camp, around that, for the incoming 6th grade. So that hopefully will be an in-person session. As Jeff had talked about, goal 2 is looking at our inclusive practices and to evaluate equity across academic and extracurricular activities. And, you know, we have seen some trends as Jeff had spoken about, you know, historically over the past, you know, 20 years or so, just with the amount of females that are enrolled in, let's say, our physics and or robotics classes. And we really want to take a look at why that is and what can we do as a district to change that. I think computer science discoveries obviously is going to help, but being able to work with having 2 representatives from our school building on the equity committee is going to be very important, but also our science and technology teachers also have an equity goal as one of their SMART goals, and coming up with collecting the data, but also coming up with ways to work with the counseling department to promote and to find out through surveys why is it that students choose the courses that they choose. Especially, all of our students take biology, but once we get sort of past those requirements, the chemistry, why is it that more females tend to go into AP biology and anatomy and physiology, and more males tend to go towards the physics and the engineering, the future. So those are some things that we are going to be taking a look at, and then coming up with an action plan as well. And the last goal is to provide mental health supports to, faculty, staff, and students. We began the school year with a professional development for our faculty and staff on mental health. The partnership with the Bright program really has been an important part for our counseling staff, also administration, because one of the difficult things is that without a program like Bright, we are, having students who are out on, hospitalizations or long-term illnesses or even concussions. And, they come back in and, to expect them to go into, a regular school day, 7 periods, and jump right back in with, what seems to be, to a lot of them insurmountable work, is, not doing them any benefit at all. So we're very pleased. We met on Friday during our snow day with the Bright organization, and we have another meeting again tomorrow to do our operational plan. So we're very excited, and I'd like to also thank Jeff and Carol and Karen for their support for this program, because I think it's one that is definitely going to be extremely beneficial to the students and our staff as well. We are planning on, we're supposed to have a refresh day for the high school tomorrow with a guest speaker on mental health. However, due to the increase in COVID cases, we have postponed that. It's not a good idea to put in, 150 students into an auditorium together for a presentation. So we are pushing that off. We're looking at doing one for both the middle school and the high school in March, because really nothing happens in March. So it's a difficult month for everybody. So hopefully we'll be able to have some excellent offerings for students to develop some strategies and to de-stress for those refresh days. So that is the school improvement plan. Anybody have any questions at all on that?
Adam?
Yes, Adam.
On the females going into STEM areas, or even some of the more math heavy STEM areas, one of the questions I'd have is, do we have a way to expose them to females who are in the workforce, working in the jobs you can get coming out of that? I think my wife's a civil engineer who works for the Mass Highway Department, right? And so I think there are women out there who would be really positive role models. And I think that when you're sitting there as a sophomore deciding between AP Bio or AP Physics, understanding how that decision can impact the career path you might take later in your career and what jobs might be available. Do you want to be at a bench, pipetting as a biologist, or do you want to be out there building a bridge? I think I wonder what we can do there if we're not doing things already to kind of expose them to those professionals.
Thanks for bringing that up. We actually have through a grant, we have Jessica Gallagher working on developing a career panel for our high school students. Interestingly enough, our physics teacher at Tohoto is a female.
Yep, great.
You know, you don't see, honestly, you don't see that very often. And we've had discussions about, you know, how to bring her even down to the middle school to introduce her to students in the middle school, and how making connections to, you know, what they're learning in computer science or what they're learning in technology and engineering class in 8th grade, and how those connections are made to the physics courses and the other courses, the CAD courses that we offer in the high school. And also, you know, prior to the pandemic, we did have guest speakers come in who were females, and I actually observed a course, a class in the fall in chemistry, where, you know, virtually it was females and females of color that were in engineering and chemical engineering jobs in workforce. And that was shown to all of the chemistry classes as well. So we are, you know, we're looking at that, and, you know, hopefully once, you know, this whole pandemic is over, we'll be able to bring in more guest speakers.
Got to get those chem engineers to share their starting salaries that everyone will want to be taking classes.
I should have done that.
Hey, Adam, if I could just jump in here, you know, one of the, in our budget proposal, you probably noticed that we had something in there of hiring another person in the guidance department. And really, the initial proposal is to introduce an internship shadowing coordinator to the department that will help our students be able to go out and do and see what goes on in the field. And so that exposure, we think we're going to help people, you know, decide maybe what they're interested in. If they see a civil engineer, if you get a female out there, see what a physicist does, maybe that generates interest. And I know that the initial idea was a junior and senior shadowing experience in your junior year, and then some kind of internship possibilities in your senior year. And I know Diane and her staff, and as Carol as well, have really done a great job of expanding that down into the sophomore year and having an entire program where in the sophomore year, we have professionals come in and speak to our kids, really like a career day, and then they go to a shadowing and then an internship experience. So
it can set our high school apart too, as people are even deciding where they're gonna go for high school, if we're offering those opportunities and others aren't. So that's great.
Anyone else?
Yeah. Just kind of, I think Adam made a kind of joking somewhat comment there at the end about showing salaries, expected salaries up there. But I mean, Jeff, you and I talked about this, right? More money, knowledge, or teaching. If we're trying to prepare a kid to choose a career or go to college, are you explaining to them what sort of salary or career potential salaries are out there? I mean, so they don't, you know, take basket weaving and get into debt and ask everybody else to pay for it? Or, I mean, you are, so that's good. All right.
Yes, you know, we are. We also go over with, when we do our scheduling, the counseling department goes over, you know, those numbers of, you know, the amount of money that someone with a bachelor's degree makes in comparison to someone that just has a high school diploma or a GED, and then it goes on to master's and doctorate, you know, et cetera, as well as some of the other careers. The program that we also use is Naviance, which is a software that does also, it not only sort of houses all of our students' applications for college and recommendations, but it also it starts out in 8th grade with career exploration, and then goes on to, you know, what colleges and what type of courses you need to take in order to be prepared for certain degrees and certain majors. So that we've had Naviance for, for years, and every year we are, building and expanding upon the offerings that Naviance has.
That's great. I imagine what my life would have been like differently if I had that sort of information in high school, which we didn't have anything like what you're talking about. So that's awesome.
Yeah.
Thank you.
Sure. And lastly, I was asked to just do a quick overview of, what is the MIAA and the Mid-Wachusett League. I believe this stemmed from, a decision that was made by the Mid-Wachusett League principals to do a temporary limit on the number of fans that would be attending our winter sports programs. And so all Massachusetts public schools are members of the MIAA, which is the Massachusetts Interscholastic Athletic Association. And the MIAA basically governs high school athletics. And not only do they sort of come up with the laws, but they also provide leadership and support for conduct and interscholastic activities. They promote wellness and sportsmanship, coaches education, community service, and leadership as well. And so each year, member schools pay a fee to the MIAA, and that fee is dependent upon the number of sports and the number of levels within each sport that your school offers. So currently there was an increase in fees for, well, I don't know if it's this school year or if it's next school year, so don't quote me on this, but our fees are right around $4,000 a year for the MIAA. And so the MIAA governs athletic events. They set basically the timeline for season calendars, when you can begin a sport, when you end a regular season, when district tournament play happens, where it happens, et cetera. So they set all of that, the codes of conduct. They set a minimum academic and attendance requirement for student athletes as well. And so Tohoto is a member of the Mid-Wachusett League. So the MIAA breaks it up into Massachusetts up into sections. And so we're part of the Mid-Wachusett League, and the league, depending upon a school size, is then broken down further into divisions. And that is due, in large part to the school's population. Sometimes, even if your school is small, but is, maybe very successful in, soccer, you may move up a division, even though you have a lower enrollment. But there's an entire process that goes along with that as well. Tohoto is currently in District E. So we have Air Shirley and Maynard, Murdoch, Narragansett, and West Boylston. Sometimes, depending upon, what school offers what sport, there may be another school that's added and one that's taken out because they don't offer a sport. And so the Mid-Wachusett principals meet on a monthly basis to discuss among other things, athletics. Jay Costa is a Mid-Wachusett principals representative as far as athletic directors are concerned, and he is from Shrewsbury. And we discuss and vote upon any and all changes, waivers that may arise during the school year. And, as you can imagine, the last couple of years with the changes in COVID and, whether to have sports, whether not to have sports, how sports are conducted, whether masks are worn, whether they're not worn. Those are all things that are discussed and voted on by the Mid-Wachusett principals. And so most recently, because what ends up happening is if you have an outbreak in let's say the girls varsity basketball team of a school, and you have 2 or 3 players that have tested positive, you have to then call the school that you are supposed to play tomorrow night and say, listen, we can't play. And that game has to be rescheduled. And so, all that sort of goes into that, working with the school nurse, working with the Board of Health, working with the coaches, contacting the athletes, doing any type of, close contact, et cetera. It is an immense amount of work. And because of the surge, all the principals and athletic directors determined that, we need to limit the amount of fans that we are having in our schools. We want to make sure that, some of these athletes have missed out on some, athletic events. And so we want to make sure that the most important people in their lives, their parents and their siblings, are able to still watch them. So we have, all of the schools have voted to temporarily limit the number of fans until we see our numbers go down. And then we'll make a vote to, to go ahead and reinstate all of those fans as well. So that's sort of just a little overview of.
Yep, good. That's very helpful. Thank you for explaining those. I'd never heard of the Midwatch group before, so I'm glad that you could describe some of this. Thank you. Adam?
Yeah, so I've just got a comment on this one, Diane. I hate the decision to limit attendance at the games. The Boston Celtics have 19,000 people watching them in a building indoors right now, and I struggle to understand why we would determine that allowing someone's classmates to come to a basketball game at a high school is a higher risk for either the athletes or the people in the building than going to watch the Boston Celtics play at TD Bank Garden. So I understand that the decision has been made, and I understand that it's also not our decision to make. And I appreciate understanding that process, but I've got to state my own opinion, which it feels it feels awful to think that, going back to my own high school experience, I wouldn't be able to go watch the basketball team that I wanted to watch compete. And if I was on one of those teams, my friends wouldn't be able to come watch me.
Okay. Thank you, Adam.
I think too, can I add one thing too?
Yeah, sure.
I think when we talk about the mental health of all the students, we have to, and I know the decision's already been made too, but I side with Adam on this one, that we can't just worry about the mental health of the athletes. We also have to keep in mind the mental health of the other kids that would want to be, just like Adam said, maybe, their only time to go be a part of the school community outside of academics is at a basketball game. And that's what's satisfying that need for them. Do you know what I'm saying? So I know that everyone's just trying to do their best here and put their best foot forward and let these athletes play. I'm an athlete myself. I get it. I'm a coach myself. I get it. And it's a really hard decision to make. But I think in making the decision, what's best for the athletes and the coaches, we're also leaving out a good population of students as well.
Diane, when did you say when the Midwatch principals revisit the data and update decisions as they go along with? Do you have a time cycle for that?
So we, we're in communication with each other probably, at least once a week. I can tell you that we had to, over vacation, as well as recently as this weekend, we had to shut some of the basketball teams down, and not have practices, because of the number of COVID cases. So, once we see that number be more consistent, within a week or 2 weeks, we will convene again and make that determination. We'll take a look at the numbers. We'll take a look at, how many games have had to have been canceled, how many, programs had to be sort of, shut down for a period of time. I can tell you, over vacation and the first week being back, that, a number of schools had to shut their programs down. I think, schools, I think it was in the news, schools and, one league decided to just basically shut down the entire winter sports. And we're trying, obviously, not to do that. And, knock on wood, we've had a good week this week. So hopefully we'll keep it going. Yes, Adam.
Susan, sorry you were muted there. And I get that, Diane, and I think that when we even rationally think about where is it likely that you would catch COVID or someone would catch the airborne Omicron variant right now, I certainly understand why we'd look at a basketball game or another indoor athletic event and say, you know what, there's a chance that that's a place where you're going to have a lot of cases. I wish we had data to back it up. I wish we had, evidence to show that, hey, this is a place where COVID spreads, because I think even we heard earlier, the majority of the spread we're seeing and the cases we're seeing are coming from students who are in the community or at home and can identify a family member or someone else who might have gotten it first, and that's where they got it from. And that's just, they're hard decisions to make. And I think more than any other area, when we're competing against other teams and other towns and cities, we're even less in control of what happens within our own district, because of the fact that you've got to have agreement across 20 or 30 different districts, and that's going to be incredibly hard to get any kind of agreement on when it comes to that.
Yeah, our cases, with the basketball team and even the cheerleading team, it wasn't just the players, it was coaches as well. And there was definitely transmission in the basketball programs.
Yep.
Absolutely.
And that, my question there, right, would be, does preventing spectators stop that?
Yeah, if I could just say, I think, when principals and the coaches meet, their first concern is first is the athletes. And so even though there might not be a lot of data, I think they try to act within the spirit of the, still within the spirit of the DESE guidelines. And if you're the only principal that says, listen, I got that data and it looks like there's not a lot of transmission, your hands are tied, because you don't want them to say, okay, well, we're not competing at your school. That doesn't help our athletes. So I'd rather see a few fans not show up than the game not take place. So, you're right about that. And when you get that many people, data is almost irrelevant. It's just whatever the majority is, that's what it is. And whatever your personal opinion, and it doesn't matter what data you have in your hand, it's just not going to matter. You have to think, we don't want us kids, we don't want our athletes to suffer. And, so I know it's a tough decision.
You have to go along to get along a little bit. I think
Yeah.
that, right?
Unfortunately, yeah.
Thanks.
I think we're going to move on. And
I hear, Diane, did I hear you correctly say that you were going to have a mental health refresh day tomorrow?
We were going to, but we postponed that till March.
I just find it funny. I guess your reasons are your reasons, but you're having the mental health refresh day because of all these COVID issues that are around. And now those same issues are causing you to postpone the mental health refresh day, when that's one of the biggest things that kids need. Do you consider, I don't know, you said you were gonna have guest speakers or something. Can they do some sort of virtual presentation or something, just to help the kids rather than put it off another month? And
yeah,
who knows what mental health issues that causes? I don't know.
So, yeah, so with, with the refresh day with the guest speaker, they are only in person. And we did sort of, typically we would have the entire high school in the auditorium at the same time. We had originally planned to just have 2 classes, 9th and 10th, and then 11th and 12th in another section. And the way that refresh day runs also is that there are certain activities that are offered. And, it would basically, it would make contact tracing almost impossible. It would be a nightmare. The contact tracing would be. But I 100%, agree with you that everybody, students, faculty, staff, administration could use a refresh day right now. But we can't do that right now.
Okay, we're going to move on. Diane, thank you for covering a lot of ground tonight and giving us a lot of new information. We haven't heard from you for a while, so it was great to catch up. Thank you. We're going to go on to school committee business now in terms of our own work. The first thing on the item under school committee goals is our liaisons to parent and community groups. And each school committee member now has a group that they're going to be liaison to. So I just want to read those off. So if anybody from those groups is listening or listens to this recording later, they'll know that you're their liaison in case you haven't been in touch with them yet. Julie is the liaison for the Berlin Parent Teacher Link group. Lori is the liaison for the Boylston PTO. Mike is the liaison for the Berlin Boylston CPAC. Megan is the liaison for the Boylston Education Foundation. Adam is the liaison for the Tohoto Stags Parent Teacher Organization, the PTO at Tohoto. I'm the liaison to the Berlin Select Board. And as an update, I have had a conversation with Chris Keefe about formalizing that liaison relationship. Chris is on the call tonight. And we've agreed, and the Berlin Select Board has voted that Chris will be the liaison to the Berlin Boylston Regional School Committee, and I'm the liaison to the Board of Selectmen. So periodically we will go to each other's meetings or contact each other to convey information or questions. So we'll be the link there. And Lori is the liaison to the Boylston Selectmen's Board, and she'll be in communication with them as well. And we expect to be visiting the selectmen approximately quarterly during the year to exchange information. So those have started. So at first, I just want to give an opportunity for anybody who happened to, is anybody already attended there? I think somebody, Adam, has attended one of the meetings. So I just want to give a chance for anybody who's already connected with their community group to give any updates that they might want to.
Yeah, so I'll just say I joined the Tohoto Stags PTO meeting last week. It was good to, introduce myself as a contact on the school committee side. I think hearing you, Susan, say that quarterly is kind of going to be the timing for you to stay in touch with the select board there in Berlin. That feels like an appropriate, period for me after that first meeting with them. I think that being able to provide information to them on what we're working on and some of the upcoming things, as well as hearing from the group as to what they're working on was helpful, and look forward to staying in touch with them.
Great. Yeah. Lori? Can't hear you, Lori.
There we go. I was unable to make the BES PTO meeting. Something came up, but I went back and forth with Jackie, who was co-chair, and I was asking her, about what was going on and different things like that. And I'm really excited to be a liaison with them. they're going to be having their second annual Are You Smarter Than a Bobcat virtual family trivia night on February 6th at 6:30. That's their only upcoming event as of now, and they're going to be sharing it on social media. And they're going to share with me, when it's going to be, so I'll be able to share with the community as well.
That sounds like fun.
I want to attend. I'm gonna.
Yeah.
Virtual.
Yeah, that's great. Yeah, that'll be fun. Also remember to ask them if they want to come get on the agenda for school committee. We used to hear from a lot of these representatives. They'd come to the committee and give us updates, and we'd see a face with a name. It was great to really see them in person. So make sure to ask if they want to be on the agenda and let me know if they do. Okay, so I want to just also we have a couple of other liaisons, just give an opportunity if there are any updates from Julie for the scholarship and awards liaison.
Sorry, am I back on? No, for the scholarships, no, we met today. I met with Susan and Mr. Campbell to go over which one did we? Read, yep, Tyler Scholarship. So Susan did a great job actually giving us a whole outline with dates of where we need to be. So it's all right there for me. It's pretty easy. I have to do a little bit of paperwork and legwork, but that's okay. Just organizational stuff. So I'm excited for it. But thank you for the guidance of that, because that's huge.
Sure, happy to do it. Lori, any updates from new member liaison?
I don't know why I can't keep unmuting. I have none at this time. I do want to let everybody know that there is an MASC offering. I have not reached out to share it with you. It was in my good intentions, which is stuck up here somewhere. But I will be emailing you this evening about the upcoming MASC workshops.
Great, thank you, Lori. And Megan, any updates on COVID dashboard information?
No updates, just obviously last week was a big week, so the graph is a little, it's not pretty. But I just think key takeaways is that when we have a vacation, obviously Christy's not sending the data the Monday after the vacation, because we're not tracking cases when we're away. So I think there were some people that were wondering, where is it last Monday? Well, we didn't track over vacation. And I think that was it.
Yeah, no, I think it'll look pretty when we start to see the numbers shrink back down again.
Yeah, yeah, and it was just, this is what we call an outlier, right? Hopefully this week is an outlier.
Yeah.
And it's one of a kind, and it doesn't happen again, but we'll see. We'll see.
I hope so. Thank you. Subcommittee reports, election subcommittee.
Yeah, hi Susan. We met last week, Adam and I. We discussed some outreach ideas and possibly having a forum at a school committee meeting in the future. So I think we're looking to ask about either the March or April school committee meeting to dedicate some time to the election and to community question and answer, or just a presentation if we'd like to do that. Because that's right before the filing deadline with the state in April, where the paperwork needs to be filed. And then soon after that, hopefully candidates will be able to take out their paperwork. So we're thinking about either a March or April school committee meeting, dedicating some time to that. We talked about some community outreach, educational things, activities. And I think we are discussing a press release. So Ken is still on this, so we'll discuss a press release about it and putting some information up on the town web pages and social media pages, trying to stick generally to just the overall town pages and information, not trying to single out separate or specific groups, because then if we miss a group, that wouldn't be fair to that group. So communicating out through the town websites. So we have another meeting coming up at the end of this month. We actually, January 31st is the day that we're going to have the meeting. So if anybody wants to attend that at 10 o'clock, that'd be great.
Thank you. And I did look ahead on the school calendar, the school committee calendar, and April would be a better month for doing that.
Sure.
Having some time for that candidate forum, just so it inform your planning.
Sounds good.
Okay, thank you. Policy subcommittee, right back at you, Mike.
Yeah, so we haven't actually had a meeting since our last update, but we do have some policies on tonight's agenda to vote on, the K policies around school solicitations and community involvement and decision-making use of school facilities. So if anybody has questions on those, feel free to ask them, but those are up for vote tonight. And we are having a meeting on Thursday this week, I believe it is. And Susan, actually, since we have this letter from the nurses, maybe we should take a look at some of the policy questions they had at that meeting Thursday, at least start talking about it maybe.
Possibly. I need to revise the agenda because I think that's.
Yeah.
So let me make a note of that. Okay. Superintendent Evaluation Committee, any updates?
Just that in the drive, there were, Susan had placed in there the rubric, the draft indicator. You can't really see it that well, but that would be helpful to go right after the meeting and just take a peek at that. I also find it really helpful just to get your notes in order and to review Jeff's goals, because different things that he said tonight were really important as far as progress goes. Because when you write at the end of the year, you want to make sure that you were not paying attention, obviously you're paying attention, but that you retain the information that he said about progress and how he's meeting those goals. So I would encourage everybody, I know everybody just wants to be done when you're done, but it just take 5 minutes. It'll make the task in May so much easier. Or is it June, Susan? Is it?
I think they start completing their evaluation at the end of May.
At the end of May, okay, that's right. Because we went back and forth with the dates a few times. But I would really just encourage you, because it'll make that task, it won't be so overwhelming. You'll have something to go off of. So.
Right, because the comments in the evaluation are evidence-based. You want to be able to cite specific information when you're giving feedback to Jeff.
Yep, thank you. That's exactly why.
Good, thank you. All right, I think we're ready to move into the business section where we'll take some votes here. We don't have too many votes on the docket. Do we have a motion? I wonder, first I want to find out if there are any questions about any of these 4 policies. Okay, so I wonder if someone wants to make a motion to accept all 4 K policies as Adam did last time. Policy KCB, community involvement and decision-making. Policy KF, community use of school facilities. Policy KHA, public solicitations in the schools. And policy KHB, advertising in the schools.
So moved.
So Mike?
Yes.
Motion to accept all 4 K policies. Second?
Second.
Megan, second. No discussion, you indicated. So all in favor? No, we can't do that. One at a time. Lori?
Aye.
Megan? Okay, I saw her mouth the word aye. Mike?
Aye.
Adam?
Aye.
And 2, 3, 4. And Julie, there you are.
Oh, aye.
And I'm an aye as well. Okay, so the K policies are updated and will be posted to the policy manual. So the school committee annual report. So I just want to make a couple of, most of the edits that I made to this version are small. I did them as track changes so you could see what was changed to the text. The most substantive thing that was changed was I deleted the budget chart, and that's because Bob was kind enough to send me his town report, and he had the exact same chart. So I thought, well, it's better in Bob's report. I left the narrative text that I had to accompany that basically, but I took the chart out. So you can see that in Bob's report instead. Otherwise, they were just small clarifications. Did anybody have any questions about any of the changes there?
Susan, did you add the change about the election?
I did. I just did it late. Mike had said there we wanted to clarify the election terms in the last section of the report that describes the regional school committee election, and I did put in a line. You should be able to see that right now, actually.
I don't see it. That's why I'm asking.
You might. Did you refresh your page? Maybe.
Yeah.
I hope it's there. Are you looking at a PDF?
PDF. Yeah.
All right. Hang on.
Shows you uploaded it at 5:49.
That sounds right. That one piece.
Does anybody else see that in there?
Hang on for a second. Go down.
Are we talking about election? That's on page
There it
6?
is. Yes, it's in page 6 in red at the bottom. Do you see any red text there, Mike, in the PDF?
Okay, I see it now. Yep, thank you.
Yep.
Yeah, so it says the first election will be for multiple 2- and 4-year terms going forward. All
Yep.
terms will be 4 years.
Yep. Yep.
Okay, cool.
Okay. So any other discussion about the town report? That will be submitted soon after today. It has to go in this month, so I'll just clean up those edits and send it to Christy, who will send it with, I assume, I think we send a packet, I assume. Adam?
Who wrote this, Susan, primarily?
Me.
I think it's great. And I just wanted to compliment whoever did, because I find it really, really helpful. As I think I said last time, a member of the committee, but having read it again, going into tonight's meeting, it's very well done.
Thank you. I appreciate that. Okay, so I will get that into Christy, and Christy will, I assume, send the whole district package over to the people who are putting together each town's town report. That'll be nice. Check that off. And then the creation of the Green Team Club. Diane, do you want to say anything about that?
Sure. So this is student driven. They would like to begin form a club for recycling at Tohoto. And they hope to grow it into working with the food service department to take a look at our use of plastic in the food service departments, in the food service department as well. So this would be to, help with the emptying of the recycling in the classrooms, in the office area, also promote more recycling in the cafeteria. And then eventually work with the food service department to take a look at the use of plastics and styrofoam in the food service department.
Cool. Yeah, great. Any questions for Dan? And by the way, Christy, I know that I just forgot to take a vote on that annual report, so I'm going to cycle back to that in a second. Any questions for Diane about the Green Team Club? Okay. Okay. So do we have a motion to accept the creation of a Green Team Club at Tohoto?
So moved.
Adam, second.
Second.
Lori.
Second.
And let's go do a roll call vote here. Megan. Lori.
Aye.
Mike.
Aye. Is this for a vote or first read?
Oh, I'm sorry. You're right. Oh no, it says first read. Yeah. So we're going to leave it as first read. It says that. So it will be first read. No vote. Take it back. And there's no urgency to this, Diane, particularly?
No, they want to get it going, but,
Yeah.
process,
Okay.
so.
All right. Okay, so now I'm going to circle back because we didn't actually take a motion and a second and a vote on the, oh no, we did the motion. Did we do a motion? No. Motion and a second.
Motion to accept the school committee annual report to the town.
Yes, thank you. Mike, second.
Second.
Adam, and a roll call vote. Megan. Aye. Lori.
Aye.
Mike.
Aye.
Adam. Julie.
Aye.
And me. Aye. All right. So that cleans up our agenda for tonight. We have a second meeting this month. I've cautioned people to hold 3 hours. Part of that meeting will go to the new agenda item that Adam made a motion for earlier, the committee voted for earlier. And I'll be planning the specifics of that session with Dorothy this week. So we'll be in touch about that agenda. And then we have 2 meetings in February, both probably pretty heavily focused on budget issues, including the second meeting, which is a public budget hearing. Lori?
Could we possibly add the creation of the Green Team Club for a vote to that January
Yeah, that's a
25th?
good idea. Yeah,
Yeah, thank you.
thank you. Okay, any other comments before we close out the night? Again, Karen, congratulations on your retirement. We are excited for you. And we thank you for all your contributions over many years. We really appreciate everything that you've done.